Good morning, everyone. Welcome to my channel, Mindsprout Learning Hub. Today, it's my first class, and we will discuss about the placental examination. Here, introduction. Placenta is derived from the Greek word plakos, meaning flat cake, and it's reflect its typical appearance. Okay, placenta is a fetal organ of pregnancy, which is responsible for providing nutrition and oxygen to the fetus as well as excretory function. Here, gross anatomy. The placental abnormalities lie along the anterior or posterior wall of uterus and may extend to lateral wall with increasing gestational age. Okay, the term placenta weighs 470 gram to 500 gram and measures 22 centimeter in diameter with a thickness of 2.0 to 2.5 centimeter. Next point, placental thickness is usually directly proportional to gestational age. To the extent that is can often predicts the gestational week, means according to its thickness we can assess the gestational age. Okay, example 21 mm thickness at 21 weeks gestation. Okay, now second is clinical characteristics of the normal placenta. First, a fresh term healthy placenta is approximately 15 to 20 centimeter in diameter, 2.0 to 2.5 centimeter thick, and height range between 40 centimeter to 60 centimeter. Its generally weight approximately 500 to 600 grams, means it is about 1/6 of the baby's birth weight. Okay, next, the maternal surface of the placenta should be dark maroon in color and should consist of around 20 cotyledons. Means we have to assess the 20 cotyledons. The surface should appear complete with no missing cotyledons. Okay, next, the fetal surface of the placenta should be shiny, gray, and translucent enough that color of the underlying maroon colors may be seen. Next, the normal cord contains two arteries and one vein during the placenta examination. Okay, there is two arteries and one vein during the placental examination. We have to assess. The delivery physician should count the vessels in either the middle third of the cord because of the arteries are sometimes fused near. Okay, the placenta and are therefore difficult to differentiate. Next, fetal membrane are usually gray, wrinkled, shiny, and translucent. It consists of two layers. We all know about the amnion and chorion. Okay. Next, the procedure of examination of placenta. What is the procedure? First, explain the procedure to the parents and ask if they wish to observe. We should have to ask the parents, either mother and father of the baby. Okay. Second, ensure that there is adequate lighting to check the placenta. If the lighting in the delivery room is dim, it is advised that the placenta is examined in an alternative location where there is adequate lighting. Means dim lighting. If the delivery room the light is dim, we should have to go in other location where we can assess the placenta very clearly. Okay, the next, prepare a flat surface with protection to avoid blood spillage. Okay, next, prepare syringe and needle if cord sample are required. If physician call to take sample, we should have to prepare syringe and needle for that. Second, wearing an apron and gloves, lay the placenta fetal side uppermost, nothing the size, shape, smell, and color. Okay. Next, examine the cord, nothing the length, insertion point, and presence of true knot or thombi. Okay. The next is observe the fetal site for irregularities such as suctionate lobes, missing cotyledons, fatty deposit, or infraction. Okay, next, lift the placenta up by the cord means lifting the placenta directly up by the cord. By doing this, membranes can be observed for completeness. Okay, there is usually a single hole where the baby passes through the membrane. Turn the placenta over to inspect the maternal surface. Next, examine the cotyledons ensuring all are present. Means we have 20 cotyledons, okay, in normal placenta. So ensuring all are present. Nothing the size and any areas of infarction, blood clots or calcification. Okay. Retain the clots to make an accurate assessment of blood loss. Means there is lots of other placental abnormalities, we will discuss about that in our next video. Okay, next point is where there is suspicious that the placenta and or membrane are incomplete, they should be kept for further inspection and referred to the duty obstetricians. Okay, next, inform the mothers of your findings, means family members. Okay, complete documentation in the woman's health card record. And here we will discuss about the interpretations. What we have to interpret: first, placental size. Placenta less than 2.5 centimeter thick are associated with intrauterine growth retardation of the fetus. Means if the placental thickness is less than 2.5 centimeter, it refers to the or indicates the intrauterine growth retardation of the fetus. Next, placenta more than 4 centimeter thick have an association with maternal diabetic mellitus, fetal hydrops, and intrauterine fetal infections. Next is placental consistency and surface. Maternal surface pallor of the maternal surface indicates the presence of fetal anemia. If the pallor color we find at the maternal surface, it means the presence of anemia of the fetus. Okay, which may be the sign of hemorrhage. Life-saving transfusion can be performed. And fetal surface, a thick ring of membrane of the fetal surface of the placenta may represent a circumvallata placenta, which is associated with premature prenatal bleeding, abruption, multiparity, and early fluid loss. A similar but thinner ring of membrane tissue represents a circumvallate placenta. Next, umbilical cord. Normal cord length is 40 to 70 centimeter. A short cord is associated with a less active fetus, fetal malformation, myopathy, and neuropathic disease, Down syndromes, and oligohydramnios. Okay. Next, short cord may result in cord rupture, hemorrhage, and stitches. Cord of insufficient length may also result in breech and other fetal malformation, prolonged second stage of labor, abduction, and uterine inversion. The last one is the umbilical cord may become excessively long because of fetal hyperkinase, knot, and thrombosis. Okay, so this all is about the fetal placental examination. Okay, so placental examination is finished. Thank you. We will meet in next video.